to get through Thanksgiving. All of those personal decisions are going to have a bigger impact on the outcome of lives than anything that government can do. So again, individual responsibility needs to lead in North Dakota. The CDC yesterday advised the same thing that our two doctors here spoke to, which is they're advising Americans to avoid traveling for Thanksgiving. They're worried, and rightly so, about a dangerous post-Thanksgiving spike of COVID-19 cases, particularly when this traditional terrific holiday, my favorite, Thanksgiving always has been, generally is the time of year when we have multi-generational gatherings, large multi-generational gatherings. As was articulately said by the doctors, that these gatherings can be dangerous, if not deadly, for those that may be vulnerable. And we look at the United States and you say, well, hey, let's travel someplace else. There have been more than 1 million new cases of COVID in the United States in the last 7 days. We hear in the Midwest, any direction you go, cases are high or even higher than they are in North Dakota. And again, this is a recommendation for the American public coming from the CDC, and they would ask for the health of your loved ones. Please to consider strongly celebrating Thanksgiving different this year, and perhaps, as Dr. Heegard said, with your immediate family household only. And now I know there's a misperception that young people sort of, quote, don't get COVID, but I wanted to throw out ahead of Thanksgiving a couple of data points. We've had more cases just among 20 to 29-year-olds in North Dakota since the pandemic began. 15,637 to be exact through today of cases between 20 and 29-year-olds than we do in the combined categories of those over 60, over 70, and 80 and over, which it totals 14,000 for those age groups. And we know that 20 to 29-year-olds can be pre-symptomatic and asymptomatic. So many of those that were tested in those age groups likely were tested because they had symptoms. And so there could be, if 2/3 of those in the younger age groups are asymptomatic, for every positive we find, there might be 2 asymptomatics in those age groups that have not been located yet. And so again, in this insidious disease, being young and healthy does not mean that you're not a spreader. So again, the safest way to celebrate the holiday is with the people you live with. And again, we ask all of you to do that, to find ways to expand this day of gratitude, to connect with others virtually as we go through this challenging time. And so again, to all have a happy Thanksgiving, but this year, make sure it's a safe Thanksgiving. We're going to quickly look at some numbers and then hear from the majority leaders. On the number side, we've got 9,900, just under 10,000 active confirmed cases in North Dakota. As I stated earlier, over 25,000 new cases already in the month of November. Our test positivity rate, again, 15% among all tests completed in North Dakota, much higher than what we want it to be. We talked about hospitalizations earlier, 289 due to COVID, another 106 that are in the hospital once they get there. If they come in for, say, an appendectomy, if you can find a spot to do that, then and get tested after you arrive and become positive, you're included in that second number. So there's 395 hospitalizations. We mention that because when a patient is COVID positive, that puts extra work on the hospital and hospital staff to make sure that infection control is in place for those patients that may have been admitted for a different purpose. Regionally, when we take a look at the upper Midwest, we continue to be in a COVID storm. Look at the case counts here, starting over in the Great Lakes in the past week, almost 85,000 new cases in Illinois, over 48,000 cases in Minnesota and Wisconsin, and South Dakota 9,000, and Montana 8,700. When we look at the positivity rate across the region, we see that there's some extremely high and some of the highest positivity rates in the country. There's 5 states in this region with positivity rates above 40%. There'd be Idaho, Kansas, Wyoming, Iowa, and South Dakota. And so again, these might be places where you might be considering traveling, but rates of infection very high in neighboring states. When we take a look at the rolling 14-day average, we're just over we've hit 15.6%, and we take a look at this line, it's way too high, but we like the fact that in the last week that this appears flat. And so again, I would say just thank you to all North Dakotans who are practicing mitigation measures that have done your part to help slow the spread, because what we do in our communities affects what we can do in healthcare. When we take a look at hospitalizations, again, these are hospitalizations that are due to COVID. We're off slightly above our peak earlier in the week, but sadly, part of the reason that we're down is because if someone who was receiving hospital care passes away, that drives this number down. And it took us over 4 months, 135 days from March 11th, when we had our first case, to August 8th to reach 111 cases or 111 fatalities. We've had 111 fatalities in North Dakota in the last 7 days. We're all connected, as was said by the doctors. It's either 1 or 2 degrees of separation between the spread of infection and someone that may have the most tragic outcome from this unpredictable disease. But as always, our hearts go out to the family and friends who've lost loved ones due to COVID-19. When we take a look at counties, we're now in a position where every county in North Dakota has at least 2 active cases. The number of active cases tend to trend with our most populous counties, but also in those most populous counties is where we have our major hospital organizations. And so again, if you're in one of the rural areas, your care is going to lead you to one of those higher areas. And so again, we're all interconnected. Within each other, and our hospital network is surely interconnected between rural and urban, and the need for transfers. When we take a look at those cases, Burley Morton combined with close to 1,900 active cases in this metro area, and the 3 other counties that have got over 1,000 cases, including Cass, and now Ward with a much smaller population at close to 1,200 in Grand Forks. And so again, we would have an opportunity to swamp our healthcare system just with the cases that are in the counties where our major hospitals are located. So again, this is why we're all in this together, because we have other counties with over 200 cases, Stutzman with 436, Stark with 358, Walsh with 327, very low population there, Williams 315, Rolette 255, and Barnes 220, and additional more counties that have got between 1 and 200. So when we take a look at active case rates across the state, this divides it by per capita. The darker counties here are the ones that have the highest rates per capita, and you can see again that, for example, that is in Ward County in the northwestern part of the state, where we do have hospital constraints. We're seeing more transfers from that part down to the central and eastern part of the state, but the cases per capita in some of those counties or up in Walsh are more than 2 times higher than we have in Cass County. So again, this is a statewide issue. Next topic is nurses. And we know that when nurses are needed for COVID and non-COVID, they're certainly needed when we have COVID hospitalizations. As we've talked about, it took us 5 months to get to 100 hospitalizations, took 4 weeks to exceed 200, and it took only 13 days for us to go above 3,000 hospitalizations due to COVID. This is the exponential growth in the infection rate of this disease. With these near record highs and immense pressure on our frontline workers, we were pleased that FEMA approved our request. We announced this last night for federal assistance, and they've authorized North Dakota to receive approximately 60 U.S. Air Force frontline medical personnel from the Department of Defense COVID-19 response operation, and these are primarily nurses, including critical care nurses. And those Air Force personnel will come from around the United States. They're expected to be here and on the ground next week. They'll join 167 nurses who are part of the North Dakota Department of Health COVID response team. Those teams will split into multiple special teams. They're going to support at least 6 hospitals in 4 cities, and these are our largest, but Trinity in Minot, CHI St. Alexis in Bismarck, Sanford Medical Center in Bismarck, Essentia in Fargo, Sanford Medical in Fargo, and All True Health System in Grand Forks. And in addition to the 60 Air Force personnel, the North Dakota Department of Health, and in addition to the 167 nurses that are already there, we're contracting at the state level with a temporary staffing agency to provide an additional 60 nursing staff for hospitals and nursing homes, and those are funded with CARES Act dollars. As we continue to weather this COVID storm that's engulfing the upper Midwest of the nation, with hospitals protecting a surge, we again are grateful to all the additional support coming from these incoming medical professions, but we're certainly grateful to the tens of thousands of people who've been working on the front lines, whether it's in EMS, in long-term care, or in our hospitals and clinics. We're grateful for the work you're doing to provide the very best care to North Dakotans. Next topic, as we lead in, relates to the school activities discussion and other things. As you know, we've amended last Friday's executive order. Team practices and rehearsals can resume with additional mitigation on November 30th, and competitions in that executive order will resume on December 14th. Our goal was and is to save the winter sports season. We understand how important this is to North Dakotans. The way we save the winter sports season is by decreasing transmissible moments now in November and over Thanksgiving. The timing and the 4-week cycle that was originally designed was between competitions was 2 incubation cycles, and that would help slow the spread and allow hospitals to catch up. We've heard feedback from lots of people, and many have said, well, you know, kids don't get it, kids are healthy, but I want to make sure that we stay data driven as North Dakotans, because kids are not immune from COVID, as you heard from the doctors. Among children's ages 0 to 18, let's take a look at the positivity rates going back to August. 0 to 18 positivity in August, 5.3%.